Good morning, everybody. Thank you all very much for coming out. This press conference today, and it's nice to see so many people who are here. The press conference today is to clarify district law as it pertains to transition-related services for people diagnosed with gender dysphoria. It is a recognized condition in the DSM, the Diagnostic and Statistical Manual, DSM-5. Gender dysphoria refers to a condition in which one's gender identity is different than that typically associated with their assigned sex at birth. So, when I refer to people diagnosed with gender dysphoria, I'm referring to people who are transgender. What we're announcing today, to me anyway, is incredibly important to the transgender community, and this cannot be overstated. According to a recent needs assessment conducted by the DC Trans Coalition, 36% of transgender men and 39% of transgender women surveyed attempted to commit suicide at some point in their lives. It's a pretty large number, isn't it? 55% of the transgender men and 65% of transgender women in that same survey stated that they've strongly considered suicide. The women and men cited here are district residents, and a major factor contributing to these astronomical rates of attempted suicide is the challenge that many transgender people face when seeking medically necessary procedures. Over the last couple of years, there's been a growing consensus among the medical community in general that some people diagnosed with gender dysphoria, may need physical treatment. Specifically, the American Medical Association and the American Psychological Association are in agreement and have publicly stated that treatment, including gender reassignment surgeries, is necessary medical care for some people with gender dysphoria, and that those services should be determined by the World Professional Association for Transgender Health standards of care. Therefore, building upon the March 15, 2013 bulletin by the Department of Insurance, Securities, and Banking, I am clarifying today that treatment for individuals diagnosed with gender dysphoria is a covered benefit in all individual and group health insurance plans in the District of Columbia, including Medicaid. Thank you. Thank you very much, and needless to say, those who know me know how proud I am that the district continues to be on the cutting edge and in the forefront when it relates to equality and fairness for its LGBTQ residents. And I think everybody in this room knows that we were extremely proud. I was the chair of the council when back in, remember that, Rick? Back in December, that's right, December of '09. Now it seems like so long ago, doesn't it? When we were very much in the forefront nationally by establishing marriage equality here in the District of Columbia. And wasn't it wonderful for the district not to have to follow behind trends that were set somewhere else, that we were very much in the forefront then, and we want to continue to be on issues that are important to the people who live in the city, especially our LGBTQ community. Now, we are joining only a handful of states that have prohibited discrimination in health insurance based on gender identity or gender expression. Today's action could not have been possible without the hard work of a lot of people. First of all, my Office of LGBT Affairs has worked on this issue for more than a year with support from our LGBT Advisory Committee. I want to thank Sterling Washington, who is our current director, who you will hear from during this presentation. And I see now our served D.C. director over there, Jeff Richardson, who was my initial appointee to the Office of LGBT Affairs, who has now gone on to other things. And Jeff, I want to thank you for your work on this issue as well. You and Sterling working together have done mighty important work in helping us move this issue forward. And no, Amy, I'm not forgetting you either. You I want to thank you too for what you've done to contribute to the trio, having done great work on this issue. Also, the leadership of DISB, which is our Department of Insurance, Securities, and Banking, our Department of Healthcare Finance, which is very ably led by Wayne Turnage. You'll hear from Medicaid Director Linda Elam soon. Mila, how are you today? Good to see you here too. And also our D.C. Department of Human Resources. All of those agencies were pivotal in this announcement being possible today. Before you hear from those agencies, I'd like to sincerely thank also Andrew Cray and Kellen Baker of the Center for American Progress, and Andy Bowen, who's been a wonderful advocate here in the city. Andy is of the National Center for Transgender Equality. CAP and NCTE were great partners to us as we began the process of clarifying this policy, and devoted many hours to the research that was necessary to be able to get us to where we are today. We're also going to hear from the Executive Director of NCTE in a little while to discuss the importance of today's action. But first, let's hear from Chester McPherson. Come on up, Chester. Chester is the interim commissioner of DISB, and then he will be followed by Linda Elam, whose title is the Senior Deputy Director for the Department of Healthcare Finance, but in point of fact, she is the Medicaid Director as well, the State Medicaid Director. Yes. Got it, guys? The State Medicaid Director. You know, I wish only that the rest of the nation were as forward-thinking as the District of Columbia. As we do these things today, isn't it time for the rest of this nation to step up and make us the 51st state in the United States of America? Probably won't happen today, but we have to keep hope alive and keep working at it. We're also going to hear from our Human Resources Director, Sean Stokes, and we're going to hear from Sterling, as I mentioned a few minutes ago, who's, of course, the Director of our Office of Gay, Lesbian, and Transgender Affairs. Each of them will go into more specifics about this issue, but let's hear first from our Interim Commissioner, Chester McPherson. Chester.
Good morning, everyone. Thank you, Mr. Mayor. Again, good morning to colleagues, to residents of the District of Columbia, to the press. I'm Chester McPherson, the Interim Commissioner for the Department of Insurance, Securities, and Banking, affectionately called DISB. I know there would be a tongue twister somewhere there. It's a big day for me, you know, not accustomed to working in the spotlight. I really enjoy being behind the scenes, quietly serving the residents. So forgive me if I have a few tongue twisters today as I get through my notes here on this very important morning here in the District of Columbia. The bulletin that we're releasing today ensures that health insurers in the district are not discriminating based on gender or identity or expression. This action, as the mayor said earlier, places the district at the forefront of this endeavor in serving our residents. Only 5 states so far have taken similar action as we are taking today. The action we're taking today will also fully implement the district's Human Rights Act by incorporating gender identity and expression as a protected class here in the District of Columbia. Specifically, the bulletin notifies insurers that are writing health insurance in the district of the department's position regarding the application of the anti-discrimination provisions in the insurance code. We first addressed this issue last year in the bulletin, and so today we're updating our guidance to the industry by further explaining the application of the Human Rights Act and the Anti-Discrimination Code in the district. And of course, as always, our action today is to protect our residents of the District of Columbia. And as you all know, those in the transgender community are oftentimes among our most vulnerable residents. And so, of course, we want no one to be left behind. In the bulletin, it explains that gender dysphoria is indeed a recognized medical condition, and the treatment for gender dysphoria, including gender reassignment surgeries, is a covered benefit. And also, individuals diagnosed with gender dysphoria are entitled to receive medically necessary benefits and services under individual and group health insurance policies covering medical and hospital expenses. I really would like to express today my appreciation to the insurers here in the District of Columbia who have been cooperating with us on this process since the first bulletin was issued. The insurers have responded positively and have quickly made necessary adjustments to their policies and benefits, and we expect them to do the same in compliance with the bulletin that we issued today. I would like to thank Sterling Washington and his team for bringing this issue to our attention and working very hard to ensure that it was given the appropriate time and attention within the government, not just at DISB, but at our sister agencies who are also represented here today. Should any of our residents encounter any problems, feel free to give us a call. Don't hesitate to reach out to us at DISB, our number 202-727-8000, or you can visit our website. So again, this is really an important day in the District of Columbia. It is an important day in my short tenure as the interim commissioner, and I thank you for allowing me the time to get through my nervousness and not miss too many of my words. And now I will transition to Dr. Linda Elam, who's here from the Department of Healthcare Finance. Thank you all. Thank you.
Good morning, everyone. And it's a pleasure to be here today. I think this is really a very positive day for the district and a culmination, as everyone has noted, of a lot of hard work on behalf of very committed folks. And I just want to say that on the Medicaid side, DHCF is, of course, the district's Medicaid agency. We started out having lots of conversations with some very committed folks, and I have to say Andy Bowen and Andy Cray were very helpful to us in presenting really important policy documents and also bringing folks with them to give us compelling stories of how the system isn't working for them or hasn't been working for them. And we started out going back and forth saying, well, on the Medicaid side, we said it's not broken. We knew what benefits were there. We knew what policies were there. It's not broken. So we kind of had to get to the understanding that it doesn't matter if the policies are there or even if the intent is there. If people feel that the system isn't working for them, if they don't feel that the benefits are available to them, or if providers are unaware of their responsibility in treating those beneficiaries. And so for that reason, it's really important for Medicaid to be here. I probably had the easiest job of my government colleagues because I did not have to initiate a change in policy. Medicaid policy, as it stands today, does meet the intent of what the mayor has presented to us today. So I'm kind of signing on as a happy contributor, or our agency is, to the health status of the residents of the District of Columbia. Medicaid is very important in the district as we cover a third of the residents. It's the highest Medicaid proportion of any state in the nation. And so we are very crucial to the very high health insurance rates that you see in the district because of our high rates of coverage. We also have very good benefits that are available, and we also were among the first states to expand Medicaid under the Affordable Care Act, and so we've even covered that many more beneficiaries through Medicaid. So again, we fully endorse the prohibition of discrimination in health insurance based on gender, identity, or expression. And again, while there are no barriers that we've seen to access to care for Medicaid beneficiaries seeking medically necessary sexual reassignment treatment, surgeries, or other therapeutic services, the perception of the providers and the perception of the beneficiaries may be that we do not cover such services, and we're here to say that we absolutely do. The benefits that are afforded to individuals seeking treatment for gender dysphoria shouldn't be construed again as newly mandated Medicaid benefits. And as with all covered services provided through Medicaid, the District of Columbia will continue to cover medically necessary transgender health services to the extent permissible through federal and local law. We are committed to ensuring that individuals diagnosed with gender dysphoria are afforded the same right to obtain benefits under health insurance, Medicaid in our case, as individuals seeking medically necessary treatment for non-gender, identity, or expression-related conditions, or as they themselves would experience for any other healthcare concerns. And so with that, we really do hope that, in addition, folks that haven't gotten health insurance because they think it wasn't speaking to their needs now have even more confirmation that health insurance is important for them and that it's there to treat all of their health care needs without discrimination. We've hit on the point of medical necessity several times, and that is to point out that there are the professional standards of care that are recognized. Those are general standards and ways, and so for each individual, that medical necessity decision is made along with their healthcare provider. So with that, I'm going to turn it over to Sean Stokes, who's the director of DCHR, who will be able to talk to you about changes to district insurance for employees. Thanks.
Thank you. Thank you, and good morning again. I'm Sean Stokes, the Director for the Department of Human Resources for the District of Columbia. First, let me say how honored I am to be here today to talk about what the District of Columbia is doing as a main employer of choice and employing many residents and people throughout the region. So, our goal in DCHR and our mission as a government is to attract, retain, and develop a well-qualified, and I want to put emphasis on a diverse workforce. What we've done today will prevent discrimination and guarantee that all employees of the District of Columbia government have equal access to health coverage and health care, and no employee will be excluded from health insurance policies based on their gender identity or expression. DCHR has worked with our healthcare providers to ensure that benefits and coverage exclusions and limitations that explicitly or otherwise target enrollees on the basis of gender identity or gender expression are removed from our health insurance plans offered to DC government employees. We also are working aggressively to make certain, absolutely certain, that insurers offering or administering health insurance plans to DC government employees cease denials, exclusions, or other limitations on coverage for medically necessary services. This is a very important step to creating a workforce that is not only diverse, but also inclusive. We fully support and thank the administration. It's been a pleasure working with you, Sterling, and previously Jeff and everyone else here, to ensure that we improve equal access to health coverage and benefit care for residents and also our employees of the District of Columbia. So again, it is a pleasure, and I'm completely honored to be here today to speak on behalf of the district government, Department of Human Resources. I'd like to ask Sterling to come up next, please.
Good morning, everyone, and thank you, Director Stokes and Mayor Gray. It is really a pleasure to be here today for this exciting announcement. This calls to mind what the Vice President said to the President when the Affordable Care Act passed. I won't quote the Vice President exactly, but this is a big deal. As Interim Commissioner McPherson said, we expect that the insurance companies will gladly comply with DISB and DHCF's clarified positions that transgender-related treatment, including gender reassignment surgeries, is necessary medical care for some individuals with gender dysphoria, and that those services should be determined in accordance with the World Professional Association for Transgender Health, or WPATH, standards of care. If a district resident has an issue with the denial of a claim for an individual or employer-based insurance policy, they can contact DISB to file a complaint. DISB can help them or direct them to the right resource. One can file a complaint online at disb.dc.gov or call 202-727-8000. If a person is covered by Medicaid, they can contact the Office of Health Insurance Ombudsman and Bill of Rights by phone at 202-724-7491 or toll free at 1-877-685-6391 or via email at healthcareombudsman@dc.gov. Both DISB and the Ombudsman follow a no wrong door policy, and DC residents may reach out to either agency, and we will work together to ensure that the issue is addressed. In addition, DISB can send staff to meet with residents to further address any questions related to the bulletin. Now it is my pleasure to introduce Mara Kiesling, the Executive Director of the National Center for Transgender Equality, who will discuss the importance of today's action for transgender residents of the district. Hopefully she won't quote the Vice President either. And as Mara comes up, I'd just like to reiterate something that the Mayor said earlier, that the Center for American Progress and NCTE have been amazing partners in this effort, and we are very, very appreciative of their expertise. Without further ado, Mara Kiesling. Thank you.
Good morning, everybody. I'm Mara Kiesling. I'm the Executive Director of the National Center for Transgender Equality. I first and foremost want to start by thanking Mayor Gray, or as we call him in the office, Governor Gray. And I want to thank Sterling and all of the DC government officials and all of our activist partners at Casa Ruby, at the DC Trans Coalition, at GLA, and at just all of the activists in town who work as individuals, and I'm missing so many other groups, so I don't want to do that, but HIPS and Whitman Walker and SMILE. DC has a really great activist community that really works together, and while I believe my colleague Andy Bowen certainly deserves some credit here, I just want to make sure that gets spread around. So I'm a policy person, and we've heard from some great policy people here, and this is about policy in a way, but it's really not. It's about real people. It's about people who are marginalized in lots of different ways, and Mayor Gray and his administration have worked really hard to eliminate some of those things, and we've seen some really, really great advancements over the last few years. The job training programs. OHR did a really wonderful public awareness and respect campaign. Just yesterday, Chief Lanier responded to a report that I was a part of writing. And we're very hopeful for some of the things that are going to happen at MPD now. There's still a lot more to do, but these are real, actual people. These are people who face marginalization, and one of the ways they have been marginalized in DC until now is that insurance companies have gotten to make decisions about their health care. And I think Americans in general are tired of healthcare decisions being made by insurance companies, and frankly being made by government policy people. This gives the opportunity for these folks to go out and have their healthcare decisions made by them and their healthcare providers. And that's really what this is about. This is an acknowledgement that trans people are real people, that our healthcare is real healthcare. It is just so wonderful to have a mayor who believes in fairness and in helping people, and I really hate to say this, but who believes in science. You shouldn't have to say that, but in most of the other states, or in many of the other states, there are chief executives who don't really believe in science. And we do have a chief executive here who believes in science. And this is also about that. This is also about understanding that being transgender is a real thing. It is a scientific fact. And transgender healthcare is healthcare. That is another scientific fact. And that the city is recognizing that is really helpful. I couldn't help but note that DC's largest employer, the federal government, still will be permitted to discriminate, but we'll take that up with OPM. There's still so much to do. There's a great bill for to help queer homeless people in the district. There's a waiting list at the Wanda Alston Center, and we're really hopeful City Council can do something about that. There's still so much economic opportunity that's missing for trans folks that we have to try to figure out how to help with. But this is a very important decision that will help real people in everyday parts of their real lives, with real doctors making real healthcare decisions instead of insurance companies making decisions based on how they can save some money. We'll be nice and phrase it that way. But anyway, I am proud to be a transgender person. I am proud to be a resident of the great state of the District of Columbia. New Columbia. And I'm proud to be an employer of 10 folks here in the district. We have not been able, as the National Center for Transgender Equality, we have not been able to get these things covered for our staff because we're too small of an employer to have any weight with insurance companies. Now we can stop discriminating against our employees. And that's an unfortunate way that I just worded that no doubt will come back to haunt me. But I'm just so proud and honored to be a Washingtonian today, and I just thank you on behalf of so many people for whom this will really be a life-saving thing. So thank you all very much.
All right. When you work on OPM about its its discriminatory policies against gender dysphoria, tell them about the self-determination discrimination that we experience in the District of Columbia also. And then we'll join arms and go up the street to the people on the Hill and let them know as well. So anyway, I want to thank all of you all for coming. This is a great day in the District of Columbia. So as we solve the issue of gender dysphoria, now let's go out and express our euphoria. Thank you very much.